Good day. We are the Group 1 and we are discussing the arrhythmia with my group mates Antonio, Domingo, and me. Now let's go for the chapter 1. In this chapter, case analysis focus mainly on the purpose as to why this case analysis is done. Furthermore, it also presents the relevant background information regarding the case being discussed and the patient history. In this chapter includes a briefly review of the theories and studies of arterial fibrillation, and the statistic related of the client case which aim to enlighten the viewers. Additionally, the parts of the analysis tackles why the student nurses conduct this case analysis. Now let's go for the introduction. An, an arrhythmia describes an irregular heartbeat. With this condition, a person's heart may beat too quickly, too slowly, too early, or with irregular rhythm. Arrhythmia occurs when the electrical signal and coordinate heartbeats are not working correctly. An irregular heartbeats may feel like a racing heart or the fluttering. Many heart arrhythmias are harmless. For the arterial fibrillation or AFib is irregular and often very rapid heart rhythm of the arrhythmia that can lead to blood clots in the heart. AFib increases the risk of stroke, heart failure, and other heart-related complications. According to the World Health Organization, arterial fibrillation long considered the most common condition leading to an irregular heartbeat. It is growing and serious global health problem. According to the first study ever to estimate the condition worldwide, prevalence, death rates, and social cost. Now, let's go for the case scenario. Client X is a 75 years old white man who has come for the wellness checkup due to fatigue that has persisted for 2 weeks despite his effort to rest. Started that he feel like he might pass out because of it. Frank was diagnosed with a hyperlipidemia 8 years ago and hypertension 5 years ago. Client X owns the manage a local restaurant. He has never smoked and consumed alcoholic beverage only on a special occasion. His age and history hypertension suggest he might be at the risk of arterial fibrillation. During the physical examination, his heart rate is 115 beats per minute with an irregular reading. His height is 59 and his weight is 220 labs. His BMI is 32.5 kilogram. This may be obese. His blood pressure is 124 over 80 and his pulse rate is 115 beats per minute. For the respiratory rate is 22 cycle per minute and with a temperature of 37.3 Celsius. Now, let's go for the client profile. For the client profile, name is client X, age is 75 years old, July 9, 1947, date of birth, male, gender. For the address, Rockford Mountain Lane, Oshkosh, Wisconsin, USA. Civil status, married. Religion, Roman Catholic. Height is 5'9". Weight is a 99.79 kilogram or 220 labs. Occupation is a restaurant owner. Date of admission is October 3 and the date of interview is October 3. Now let's go for the assessment. For the assessment, health perception and health management. For the family history of illness, the client family that's not shown any illness of the family member. For the past medical history, the client was diagnosed with a hyperlipidemia 8 years ago and the hypertension of 5 years ago. For the admitting history, last October 3, 2022 at around 10 a.m. in the morning, the client came due to fatigue that has persisted 2 weeks despite his effort to rest, and he started that he feel like he must pass out because of it. For the status of present illness, For the upon interview of the student nurses, the client started that he drink alcohol occasionally. And then upon physical examination, the client has a pulse rate of 155 beats per minute. And the irregular heart rhythm and the client's state experience fatigue and dizziness, but denies experiencing palpitation, shortness of breathing, or the chest pain. Now let's go for the vital sign. For a date of admission is October 3, 2022. Temperature is 37.3 Celsius. For the blood pressure, 124 over 40 mmHg. For the pulse rate is 115 beats per minute, and the respiratory rate is 22 cycles per minute. Now let's go for the physical assessment. According to the physical assessment, neck with the abnormalities because of the jungular distension. And then for the chest, with the abnormalities because of the chest wall intact, the asymmetrical, but heart murmurs or the whistling sound are present, and the respiratory rate is 22 cycles per minute. And the thorax with the abnormalities because of the asymmetrical has poor expansion and poor breathing pattern. Upon the interpretation, the area of proceed with the significant changes is the neck with the jugular vein tension, chest with the heart murmurs or the whistling sound, and present with the respiratory rate of 22 cycles per minute with a poor expansion and a poor breathing pattern. Now let's go for that chapter 2. For the chapter 2, case discussion and the presentation. Although arterial fibrillation can occur without any sign of symptoms, it may sometimes cause fatigue, chest pain, heart palpitation, troubling of breathing, low pressure, dizziness or fainting, weakness, and other signs of symptoms. Arterial fibrillation may be caused by the certain conditions such as high blood pressure, heart attack, coronary artery, abnormal heart valves, congenital heart disease, lung disease, viral infection, or any obstructive thyroid gland, previous heart surgery, stress, or exposure to caffeine, tobacco, alcohol, and certain medication may also lead to arterial fibrillation. If not treated, arterial fibrillation can lead to serious problems such as blood clots, stroke, and heart failure. It is more commonly in older adults and it also called a fib. Now let's go for the anatomy of the heart. The layer of the heart muscle has three layers, and they are epicardium, myocardium, and endocardium. The chamber of the heart has a four hollow chamber or cavities, has two arterial and two ventricles. The great blood vessel of the heart, the great blood vessel provide the pathway for the entire cardiac circulation process. For the heart valve, the heart is equipped with the four valves, which allow to blood flow in only one direction through the heart chamber. For the cardiac circulation vessel, although the heart chamber are bathed with the blood, almost continuous the blood contained in the heart does not nourish the myocardium. Blood vessel is the circulates inside the blood pressure, which form a closed transport system, that so-called vascular system. Tonics expect the microscopic capillaries. The walls of the blood vessel have a three coats of tunics: tunica intima, tunica media, tunica externa, or the major. And the major arteries is the aorta, that the organ they serve are listed next in the sequence of the heart. Arterial branches is the aorta spring upward from the left ventricles of the heart and ascending aorta. Arterial branches of aortic arch. The aortic arch is the left as the aortic arch. The ascending aorta is the upward of the left vertical of heart in the ascending aorta. For the thoracic aorta is the downward through the thorax, followed by the supine as the aortic aorta. For the abdominal aorta, the aortic pass through the diaphragm into the abdominopelvic cavity, which is become in the abnormal aorta. For the major veins, is covered the vena cava, right arterium in the heart. Vein drain into the superior vena cava. Veins drain into inferior vena cava, which mean longer the superior vena cava returns to the blood to the heart all regions below the diaphragm.
For the pathophysiology, non-modifiable factors, age 75 years old, sex male, and then race is American. For the modifiable factors, there is hypertension, obesity, and alcohol intake. First, there will be a lower ventricular hypertrophy and a lower ventricular systolic and or diastolic dysfunction. Then, the activation of renin-angiotensin-aldosterone system. So, dito po, associated siya sa um, blood pressure regulation. Siya yung nagmo-modulate ng blood volume, then yung sodium reabsorption, potassium secretion, water reabsorption, and vascular tone. After po nun, on the leftmost corner, there will be left atrial pressure and size. So, dito po is nai-indicate ang feeling of pressure. Then, there will be atrial hypertrophy and fibrosis. So, sa atrial hypertrophy, nagkakaroon ng heart enlargement. And then, sa fibrosis is the thickening and scarring of the tissue. After that, there will be an increase of inflammation, then increase in oxidative stress. Dito naman, nagkakaroon ng disturbed balance between the production of reactive oxygen species and antioxidant defenses. So, to make it short, nagkakaroon siya ng cell death. Then, an increase in sympathetic activation, which is pagsispeed ng heart rate, kasi nagtatry yung heart na mag-supply ng good amount of oxygen gamit sa pagpapump ng blood para mabawasan yung oxidative stress. Then after that, magkakaroon ng atrial, structural, and electrical remodeling. Then for the signs and symptoms, based from the client is tachycardia, then anxiety and fatigue, which leads to arrhythmia with its common type atrial fibrillation.
Chapter 3, Laboratory Results. So, laboratory tests can help determine a diagnosis, plan treatment, check to see if treatment is working, or monitor the disease over time. First is echocardiogram. It is a type of ultrasound used to provide a view of the heart to determine if there is a heart muscle or valve disease that may be causing an arrhythmia. For the laboratory results, an echocardiogram shows mild concentric left ventricular hypertrophy and mild left atrial enlargement. The results are otherwise within normal limits. Next is the electrocardiogram or the ECG. An electrocardiogram is a simple test that is used to check if the heart's rhythm and electrical activity of the patient. For the laboratory result, the figure shows that the ECG result of the client with irregular heart rhythm and P waves are not present and are replaced by F waves with an irregular rhythm.
Nursing Care Plan Number 1, Activity Intolerance. For the assessment, subjective, I really feel tired even when I try to do simple activities as verbalized by the client. Objective, fatigue and pulse rate of 115 beats per minute. Vital signs taken as follows. BP 124/80 mmHg, temperature 37.3 degrees Celsius, respiratory rate of 22 cpm and pulse rate of 115 beats per minute. For the nursing diagnosis, it is activity intolerance related to insufficient oxygen for activities of daily living as evidenced by fatigue and pulse rate of 115 beats per minute. For the outcome identification, after 1 week of nursing interventions, the client will be able to report a measurable increase in activity tolerance and demonstrate a decrease in physiological signs of intolerance. Then, for the planning, short term, within 1 hour of nursing interventions, the client will be able to identify negative factors affecting activity tolerance and eliminate or reduce effects when possible, and participate willingly in necessary desired activities. For the long term, within 1 week of nursing interventions, the client will be able to use identified techniques to enhance activity tolerance and demonstrate a decrease in physiological signs of intolerance. For the intervention, independent nursing interventions evaluate the client's actual and perceived limitations and severity of deficit in light of usual status. This is to provide a comparative baseline and information about needed education or interventions regarding quality of life. Then, ascertain the client's ability to stand and move about and the degree of assistance necessary or use of equipment. This is to determine current status and needs associated with participation in needed or desired activities. Reduce intensity level or discontinue activities that cause undesired physiological changes. This is to prevent overexertion. Then increase exercise or activity levels gradually and teach the methods. To conserve energy, such as stopping to rest for 3 minutes during a 10-minute walk or sitting down to brush hair instead of standing. Then provide positive atmosphere while acknowledging the difficulty of the situation for the client. This helps to minimize frustration and rechannel energy. Then instruct client in proper performance of unfamiliar activities and in alternate ways of doing familiar activities. This is to conserve energy and promote safety. Then plan for progressive increase of activity level or participation in exercise training as tolerated by the client. This is because both activity tolerance and health status may improve with progressive training. Then, give client information that provides evidence of weekly or daily progress. This is to sustain the client's motivation. Then, assist client in learning and demonstrating appropriate safety measures to prevent injuries. Then, provide information about the effect of lifestyle on activity tolerance. This is because many of these factors may be amenable to modification, thus reducing risk factors and promoting health. Next, we have to encourage client to maintain a positive attitude, suggest use of relaxation techniques such as visualization or guided imagery as appropriate. This is to enhance their sense of well-being. For the dependent nursing interventions, first we have to note treatment-related factors such as side effects and interactions of medications. This can give an effect to the nature and degree of activity and tolerance. Then, provide and monitor response to supplemental oxygen, medications, and changes in treatment regimen. For collaborative nursing interventions, provide referral to other disciplines such as exercise physiologists, psychological counseling therapy, occupational or physical therapists, and recreation or leisure specialists as indicated. This is to develop individual, appropriate therapeutic regimens for the client. Then, implement the physical therapy or exercise program in conjunction with the client and other team members. This is because a collaborative program with short-term achievable goals enhances the likelihood of success and may motivate the client to adopt a lifestyle of physical exercise for the enhancement of health. Then, refer to appropriate resources for assistance and or equipment as needed. This is to sustain the activity level. For the evaluation within 1 hour of nursing interventions, the client was able to identify negative factors affecting activity tolerance and eliminate or reduce effects when possible, and participate willingly in necessary desired activities. Goal was met. Within 1 week of nursing interventions, the client was able to use identified techniques to enhance activity tolerance and demonstrate a decrease in physiological signs of tolerance. Goal was met. Nursing care plan number 2. For the assessment, subjective, I have a hard time breathing, as verbalized by the client. For the objective, pulse rate 115 beats per minute. Restlessness, decrease in productivity. Vital signs taken as follows: blood pressure of 124 over 80 mmHg, temperature of 37.3 degrees Celsius, and respiratory rate of 22 cycles per minute with pulse rate of 115 beats per minute. For the nursing diagnosis, anxiety related to breathlessness as evidenced by restlessness, decrease in productivity, and pulse rate of 115 beats per minute. For the outcome identification, after 1 week of nursing intervention, the client will be able to appear relaxed and report that anxiety is reduced to manageable level. For short term, within 2 hours of nursing intervention, the client will be able to verbalize awareness of feelings of anxiety. For long term, within 1 week of nursing interventions, the client will be able to identify healthy ways to deal with and express anxiety and demonstrate problem solving skills. For the independent nursing interventions, first, determine current prescribed medications and recent drug history of prescribed or over the counter medications. These medications can heighten feelings of sense of anxiety. Then, identify the client's perception of the threat represented by the situation. Distorted perceptions of the situation may magnify feelings. Understanding the client's point of view promotes a more accurate plan of care. Then, establish a therapeutic relationship conveying empathy and unconditional positive regard. Note that the nurse needs to be aware of his or her own feelings of anxiety or uneasiness, exercising care to avoid the contagious effect of transmission of anxiety. Then, assist the client in developing self-awareness of verbal and nonverbal behaviors. This is because becoming aware helps client to control these behaviors and begin to deal with issues that are causing anxiety. Then we have to acknowledge anxiety or fear. We must not deny or reassure the client that everything will be all right. This is because we have to validate the reality of feelings. False reassurances may be interpreted as lack of understanding or dishonesty, further isolating the client. Then we have to provide accurate information about the situation. This helps the client identify what is reality based. Then we have to use cognitive therapy. This is to focus on our correct faulty catastrophic interpretations of physical symptoms. Provide comfort measures, which is a calm or quiet environment, soft music, a warm bath, back rub, or a therapeutic touch. This aids in meeting basic human need and decreasing sense of isolation, also assisting client to feel less anxious. Then we have to assist the client to use anxiety for coping with the situation if helpful. Moderate anxiety heightens awareness and can help client to focus on dealing with problems. Then, we have to encourage the client to develop an exercise or activity program. This may serve to reduce the level of anxiety by relieving tension. For the dependent nursing interventions, we have to administer medications as ordered, then refer to the physician for drug management alteration of the prescription regimen. Drugs that often cause symptoms of anxiety include aminophylline, theophylline, anticholinergics, dopamine, and steroids. For collaborative nursing interventions, refer to individual or group therapy as appropriate. For the evaluation, within 2 hours of nursing intervention, the client was able to verbalize awareness of feelings of anxiety. Goal was met. Within 1 week of nursing interventions, the client was able to identify healthy ways to deal with and express anxiety and demonstrate problem solving skills. Goal was met. Chapter 5 Drug Study. For drug en route, generic name is warfarin, brand name is Coumadin, and classification in the pharmacologic class is coumarin derivative, and therapeutic class is anticoagulant. Then for the mechanism of action, interferes with the liver's ability to synthesize vitamin K dependent clotting factors, depleting clotting factors. This action in turn interferes with the clotting cascade. By depleting vitamin K dependent clotting factors and interfering with the clotting cascade, warfarin prevents coagulation. For the indications, this is indicated to prevent or treat pulmonary embolism, recurrent MI, thromboembolic complications from atrial fibrillation, heart valve replacement or MI, and venous thrombosis. For the contraindications, it is contraindicated to bleeding or bleeding tendencies, blood dyscrasias, cerebral or dissecting aneurysm, cerebrovascular hemorrhage, diverticulitis, eclampsia or preeclampsia, history of warfarin-induced necrosis, and hypersensitivity to warfarin or its components, malignant or severe uncontrolled hypertension, malnutrition, and emaciation, mental state or condition that leads to lack of patient cooperation or unsupervised situation, pericardial effusion, pericarditis, polyarthritis, prostatectomy, recent or planned neurosurgery, ophthalmic surgery, or spinal puncture, severe hepatic or renal disease. For the adverse reaction in the CNS, it is coma, intracranial hemorrhage, loss of consciousness, syncope, and weakness. Then for the CV, it is angina, calcium numeric, arteriolopathy, chest pain, and hypotension. For the ENT is epistaxis, intro intraocular hemorrhage, and then for the GI, it is abdominal cramps and pain, diarrhea, hepatitis, jaundice, nausea, vomiting. For the GU, it is hematuria and vaginal bleeding. Then for the HEME is anemia, potentially fatal hemorrhage, and then for the skin is alopecia, ecchymosis, petechiae pruritus, purple toe syndrome, tissue necrosis, and for the others, it is anaphylaxis. For the nursing responsibilities, before we have to review the 12 rights of drug administration, then avoid IM injections during warfarin therapy if possible, because they can result in bleeding, bruising, and hematoma. During, monitor the patient with hepatic impairment closely for bleeding because hepatic impairment decreases metabolism of warfarin and, and impairs synthesis of clotting factors. Expect to monitor patients' INR more frequently. Monitor patient for persistent, severe, sudden, or unusual signs of symptoms as warfarin therapy may cause many adverse reactions, including calciphylaxis, a syndrome of blood clots, calcification of blood vessels, and skin necrosis. After, explain that warfarin therapy aims to prevent thrombosis by decreasing clotting ability while avoiding the risk of spontaneous bleeding. Then instruct patient to take drug exactly as prescribed at the same time each evening. Then advise patient if a dose is missed to take it as soon as it is remembered on the same day, but not to take a double dose the next day to make up for it. Then, urge patient to keep weekly follow-up appointments for blood tests and after discharge until PT and INR levels are stabilized. Then, advise patient to avoid alcohol during warfarin therapy. Then urge client to take precautions against bleeding such as using an electric shaver and a soft bristled toothbrush. Caution patient to avoid activities and could cause traumatic injury and bleeding. Advise patient to avoid drastic changes in dietary habits such as eating large amounts of leafy green vegetables. Explain that dark leafy green vegetables contain vitamin K that counteracts the effects of warfarin. Urge patient to notify prescriber immediately about unusual bleeding and any unexplained symptoms. Then advise patient to consult prescriber before taking other drugs, including OTC drugs and herbal remedies during therapy. Urge patient to carry medical identification that reveals he's taking warfarin. Then tell patient Then tell patient to inform all dentists and healthcare professionals that he is taking warfarin, especially before any procedure or surgery, including dental, is performed. For the second drug, generic name dabigatran, brand name Pradaxa. For the classification, pharmacologic class is direct thrombin inhibitor, and for the therapeutic class is anticoagulant. For the mechanism of action, this directly inhibits thrombin from converting fibrinogen into fibrin during the coagulation cascade. The inhibition of this activity prevents the development of blood clot. For the indications, to reduce the risk of stroke and systemic embolism in patients with non-valvular atrial fibrillation. For the contraindications, this is contraindicated to active pathologic bleeding, hypersensitivity to the bigatran or its components, and presence of mechanical prosthetic heart valve. For the adverse reactions, for the CNS, it is intracranial or intraspinal hemorrhage. For the CV, it is pericardial bleeding. For the ENT, it is intraocular bleeding. For the GI, it is diarrhea, dyspepsia, esophageal ulcer, gastritis-like symptoms, gastrointestinal hemorrhage, nausea, retroperitoneal retroperitoneal bleeding, upper abdominal pain. For the HEME, it is bleeding and thrombocytopenia. For the MS, it is intra-articular bleeding and intramuscular bleeding with compartment syndrome. For skin, it is pruritus, rash, urticaria, and for others, it is anaphylactic reaction or shock angioedema. For the nursing responsibilities, before we have to review the 12 rights of drug administration. Be aware that patients converting to warfarin to the bigatran therapy should begin the bigatran therapy when their international normalized ratio is below 2.0. Be aware that degree of anticoagulation does not need to be assessed by routine laboratory testing with the bigatran use. However, when necessary, expect the prescriber to use activated partial thromboplastin time for or Echocardiogram clotting time and not INR to assess for anticoagulant activity for the patient receiving the bigatran therapy. During, for premature discontinuation of the bigatran increases the risk of thrombotic events. Be aware that patients receiving spinal or epidural anesthesia or spinal puncture are at risk of developing an epidural or spinal hematoma, which can result in long-term or permanent paralysis. Monitor patient frequently for signs of symptoms of neurologic impairment. Notify prescriber immediately if patient complains of bladder or bowel dysfunction, midline back pain or numbness, tingling, or weakness in the lower extremities. After, tell patient to take the Pegatran exactly as prescribed. Instruct patient to swallow capsule whole without breaking, chewing, or emptying the contents of the capsule prior to ingestion. Tell patient that if he misses a dose, he should take it as soon as he remembers or in the same day he missed the dose, unless it is within 6 hours of the next dose. He should never double a dose to make up for a missed dose. Instruct patient to keep bottle tightly closed when not used and store in the original package to protect from moisture. Have patient date bottle when opened and tell him to discard any remaining drug if not used within 4 months of initially opening the bottle. Urge patient to take precautions against bleeding, such as using an electric shaver and a soft bristled toothbrush. Caution patient to avoid activities that could cause traumatic injury and bleeding. Urge patient to notify prescriber immediately about unusual bleeding and any unexplained symptoms. Caution patient not to stop taking the Bigatron abruptly. Urge patient to carry medical identification that reveals he is taking the Bigatron. Tell patient to inform all healthcare providers that he is taking the Bigatron and not to take any medication, including OTC drugs, without first consulting the prescriber.
So, moving on to the chapter 6, summary, conclusions, and recommendations. So, for the summary of findings, the underlying problems of the client have been identified from the data gathered. The study contributed to the student nurses to render effective and quality nursing care. So, here are some of the gathered findings. First is to respect the client's privacy. The client's name has been hidden. He lives in Cabanatuan City. Next is the client was diagnosed with arrhythmia. Next, the client also manifested some chest discomfort. The client is not aware about her existing condition, and the student nurses performed interventions to promote client's health status. For the conclusions, so based on the findings of the study, the following conclusions are drawn. The family and the client understand and follow the appropriate health teaching, monitor frequently for signs and symptoms of worsening conditions, notify the healthcare provider immediately if the symptoms persist, for this may indicate the worsening status of the client and prolonged discomfort from the dizziness, shortness of breath, or chest pain. Thus, the efficient and proper nursing interventions can be provided immediately. For the recommendation, medication. Instruct the patient and the family to comply with the prescribed medication. Instruct the patient and the family to complete the whole duration of the drug. Next is for the environment. A greater risk of arrhythmia disease is associated with occupational exposure to vapor, gas, and fumes, for this significantly affects the condition of the client. A properly ventilated, low light, and balanced room temperature is recommended for the client with arrhythmia disease. For the treatment, orient the family about the patient's condition and necessary information such as the treatments and recovery process. Encourage the patient and family to comply with the treatment regimen and increase checkup. Next is the health teaching. Advise to take the medication on time with the right dose, encouraging the client to rest plenty and stay with physical active that can reduce stress, as intense stress and anger can cause heart rhythm problem for people with arrhythmia. Next is the diet. Eat a heart healthy diet foods with 20 to 30 grams of fiber each day, such as bread, pasta, nuts, seeds, fruits, and vegetables. Eat a good source of protein at least twice a day to help maintain strong respiratory muscle. Good choices include milk, eggs, cheese, meat, fish, poultry, nuts, and dried beans or peas. And for spiritual, provide emotional support to the client and advise to always pray and have faith to God.